Hello friends, in this video we'll talk about shoulder joint. So first we will see the type and articular surfaces, the capsule and ligaments, the synovial membrane, relations, movements and the muscles, blood and nerve supply and the applied aspect. So first the type and articular surfaces. So basically we'll see the articular surfaces. Here we are finding the head of the humerus and the glenoid cavity of the scapula. Now what will be the type of this joint? Let me know your answers in the comment section. What type of joint is the shoulder joint? Okay. Now let us see the capsule and ligaments. So where is the joint capsule? Over here. It is from the shaft of the humerus to the glenoid cavity of the scapula. Like this the joint capsule goes. And here are the ligaments. We have the coracohumeral, acromial and transverse humeral ligaments here. Between the two lips of the humerus, we have the transverse humeral. Between the coracoid process and the greater lip, we have the coracohumeral, and acromial will be between the coracoid and the acromion process. Okay. Next continuation. Here we are finding the capsule. This is coming from the infraglenoid tubercle extending up to the supraglenoid tubercle. It is a C-shaped capsule. Remember first letter of capsule, C. C-shape. Okay. Here also we are finding the biceps and the glenohumeral ligaments. The superior, inferior and middle. Let us see the synovial membrane. Here it is. The synovial membrane. Here it will be. It will be enclosing the ligaments. The ligaments of this joint. Okay. Now the relations, let us see. We have the posterior, anterior and inferior relations. Okay. So on posterior, anterior, deltoid is there. We have the deltoid common here. We have the coracoid and acromion process with the connecting ligament. Okay. This is the anterior what I am talking now. Here we have the coracobrachialis and the biceps. Also we have the subscapular bursa with the subscapularis muscle. Also we have the pectoralis major. Posterior we have the infraspinatus, the supraspinatus with the bursa, the teres minor. Okay. Inferior we have the axillary vessels and nerves. Okay. Along with posterior circumflex humeral vessels or just circumflex humeral arteries. We have the triceps, long head. Also we have the teres major. And extra we are finding the glenoid cavity, the bursa and the joint capsule. Let's see the movements and the muscles. Deltoid does all the movements except medial rotation. Okay. And latissimus dorsi as a primary muscle will extend and adduct. Pectoralis major will flex and adduct. Okay. Supraspinatus will abduct. Subscapularis is a medial rotator. Right. Let us see secondary muscles. Biceps. Biceps is doing flexion and adduction. Triceps is doing adduction and adduction and extension. Coracobrachialis is doing flexion and adduction. Teres major is doing extension and adduction. And pectoralis major, here the only movement it can do is flexion. Okay. Then we have the coracobrachialis. I have said flexion, adduction, coracobrachialis, right? And then we are finding the serratus anterior trapezius. Only one movement, abduction. Okay. Then latissimus dorsi, medial rotation, deltoid. Deltoid as a secondary muscle will do medial rotation. In short, deltoid does all the movements except medial rotation as a secondary muscle. Then teres minor and infraspinatus lateral rotation. Okay. Let's see the blood and nerve supply. We have already seen the circumflex humeral. Extra we add supra and subscapular. And the nerve supply. Same way, we add the suprascapular and musculocutaneous. Why musculocutaneous? Because biceps is there. Short head of biceps will be there. Okay, that's the reason. Now, applied aspect, we are finding the dislocation of the shoulder joint. So anyway, now we have to remember that the shoulder joint is very mobile. So there is a higher tendency for the dislocation. Please remember this point forever, that any joint which is highly mobile has higher chance for dislocation. This doesn't mean that less mobile joint cannot get dislocated. No. Even less mobile joint can be dislocated, but the chances are very bleak. Okay. But yeah. So here mostly inferior dislocation is happening. Compare with the hip joint. Compare with hip joint, you'll understand. And also compare with the mandible. Mandible is dislocated anterior. Here it is inferior. Inferior because of the inflammation of the subacromial bursa, or it can be a rotator cuff tear, or it can be during injury, that is collision, when you collide with any very heavy object, or when two people collide, then also shoulder joint dislocation can happen. It depends on the force and this velocity of the collision. Okay, and also there might be the poor blood supply of the humerus. So many reasons for shoulder joint dislocation. Right, I told subacromial bursitis or the frozen shoulder. Okay, this is very common in old age. It can happen in young age also. Okay, even in the teenage stage also it can happen. So references from where I took the pictures. That brings us to the end of the video. So thank you so much. I'll see you in the next video.